is Brittany Millican, and I'm a senior at Eastland High School, and today my informative speech is going to be over the disorder hemophilia. Many people do not know about hemophilia because it is so rare, but it is a disease that affects your blood clotting. There are two forms of hemophilia. There's hemophilia A and hemophilia B. If you have the A form, you have very low levels of clotting factor 8, and for the B, you have very low levels of clotting factor 9. The clotting factors are the proteins that are needed for your blood to clot properly. These, it ranges from mild to severe. This disorder is sex-linked, which means that it's passed on from an infected parent. Women do not get it. It's very rare for a woman to have hemophilia. They can be carriers, but they don't normally get it. It is normally for the males. 1 in every 5,000 males born are infected. An infected individual would bleed spontaneously and for longer than a normal person would after injury or surgery. So small children you would probably find out if they had like surgery of some sort or like fell off their bike and started bleeding and didn't stop bleeding. The mild form you probably wouldn't know until you're much older because it's not severe. Some children affected, them and their parents both don't know that they're affected with it until something happens, where they are harmed by having surgery or just get into an accident or something like that. There is internal and external bleeding, but internal bleeding is more severe. Some signs of the internal bleeding would be your bleeding of your joints, your brain, your kidneys, your intestines. The main treatment for hemophilia would be replacement therapy, which is where the clotting factor that you're missing, depending on which form you have, is either injected into your veins or it is dripped into your veins, and they're injecting or dripping in blood, human blood normally. That would help you, but it's clean, that way you can't get anything from it. The complications for having replacement therapy would be developing antibodies that would attack the clotting factor that has been injected into you, viral infections, or damages to your joints and muscles. You can also do the home form of replacement therapy, which a lot of people do, and it helps cut down the cost of having replacement therapy, and also it's just for small children it's a lot easier because they're getting used to it, and that way when they get older and they do go to the hospital, they're more used to the treatment and how it goes, and they're not so scared. There's also desmopressin, which is a man-made hormone, and it's used for hemophilia A. It can be used in hemophilia B or the severe form of hemophilia A. Antifibrinolytics is a pill that can be taken with the replacement therapy, and it keeps the blood from breaking down, the blood clots breaking down. If you have the mild form of hemophilia, you usually don't need replacement therapy, though DDAVP, which is that hormone, is used. If you have moderate, it's the same way. You can have replacement therapy, but also the hormone usually does work. If you have the severe form of hemophilia, though, you will need replacement therapy because it's so severe. You will need this treatment 2 to 3 times a week, and obviously if you're losing a lot of blood, you can die from this. So if you start bleeding excessively, you should probably try to seek help. If you see large bruises start popping up, then that is signs of internal bleeding, and you should be taken to the hospital very fast to get that taken care of. People that have with small children that they do not know they're affected, they need to watch out for the signs, mainly in males, because like I said, girls don't usually get it. And if you see large bruises pop up and there's no explanation for them, that usually means internal bleeding, and they should be taken to the doctor. My resources were Medical News Today and National Heart, Living, or Blood Institute.gov. That is all for my hemophilia speech. Thank you for your time and attention.